In this morning's medical alert, Dr. Carl May of the May Eye Care Center up in Pennsylvania joins us this morning to talk a little bit about LASIK and a new procedure that could really help people over 40 eliminate the need for glasses.
That's right. There's a new procedure now that allows people to see near and far, whereas prior to this, LASIK was mainly for distance vision.
All right, and so what makes this one different, better?
What's different about this is we make one eye clear for far away and the other eye clear up close, so you can not only see far away, but you can also read. Works very well.
Okay, and are we talking about people who never needed glasses before or didn't need them until they turned 40?
We're talking about people who needed glasses before, and then when they turn 40, they need to go into bifocals or add reading glasses on top of their contacts.
Okay, so this is really progressing pretty quickly and it's doing pretty well. Let's talk about how well LASIK has done since it started, this surgery.
LASIK started about in the mid-90s, and the procedure's gotten much more sophisticated and much more accurate for patients. There's something called custom LASIK where we match the fingerprint on the surface of your eye, the uniqueness of your eye. With special measurements, we can now carve away any imperfections that are unique to your eye and give you much better vision, sometimes even better than 20/20, what we call supervision.
And some of those side effects that people talked about, spots afterwards, things just weren't quite right after getting the surgery. That's still risky, but have you worked out most of those kinks?
The two biggest side effects are dry eye and glare at night. And with the newer lasers that are out, the glare at night has been greatly reduced, almost to the point where in the first few weeks you notice it, and then most patients say it doesn't interfere with their lifestyle whatsoever.
Let me ask you this, for people who forgot it when it first came out in the 90s, are they finding that they need to do something sort of freshen it all up now?
Most people that had it in the 90s are doing fine. There are people that if they had significant glare, we can now correct that with the newer lasers.
Oh, wow. Okay, so who is an ideal candidate for the LASIK surgery?
Anybody that's over 21. We can now do nearsightedness, people who see near and not far, farsightedness, and with the newest procedure, we can do people over 45 that are now going into reading glasses.
And who shouldn't get it? Who should not?
There are candidates that should not get the procedure, and that's one of the things about finding a good physician, somebody with experience, because there's a certain percentage of candidates that, LASIK people that aren't good candidates because of the health of their eye, they're out of the range of the laser. There are certain things we look for, extreme dry eye, the shape of the surface of the eye may not be good for the surgery.
Okay, and you say make sure somebody's experienced, and you want to make sure that the surgeon you choose has done this at least, I don't know, how many times?
You want somebody who's doing hundreds or thousands of the procedure, not somebody who's done 5 or 10 or doing them sparingly. You want somebody who's doing it on a regular basis.
So that's a really important question to ask.
Exactly.
Okay, thank you so much for coming in, Dr. May.
Sure, thank you.
And for more information, you can go to www.mayeyecare.com. And don't go away. When we come back, tips from our side.